Okay, this is Chapter 9, Lifespan Lifespan Development applies fundamental knowledge of lifespan development and management. Human beings evolve throughout their lifespan, and advanced EMTs must be aware of the changes of a person that undergoes at various stages of life. So, when the first one is the infants, they're from ages 1 month to 1 year. Some of the vital signs, correction, and then neonates are from birth to 1 month. So once you get that 1 month part, you call it infant. From the time you are birthed to that 1 month part, and you are considered a neonate. So some vital signs pulse rate will be at birth between 90 to 205 beats per minute. Within the first half hour, it drops to 120 beats per minute. And as you can only imagine, that's just getting used to the outside environment from the partially controlled environment that they were in during pregnancy. Blood pressure directly corresponds to the weight. So at birth, the average systolic blood pressure of an neonate is 67 to 84, and 85 to 104 by the year of age 1. So the body temperature will be between 98 degrees to 100 degrees Fahrenheit. Normal temperature should be 96.8 to 99.6 degrees Fahrenheit. Always think about your respirations too. They're usually faster, and it should slow by age 1. It's 20 to 30 breaths per minute. Also, tidal volume in neonates start at 6 to 8 milliliters per kilogram, but it can increase to 10 to 15 milliliters per kilogram by the end of the first year. The weight of a neonate usually is between 6 to 8 pounds. So the head accounts for 25% of the infant's body weight. After the first week of birth, neonates lose about 5 to 10% of their birth weight due to just fluid loss. So then the weight doubles by 4 to 6 months and triples by the end of the first year. Their cardiovascular system, the neonate makes its transition from fetal to independent circulation. The pulmonary system, neonates are primary nose breathers. Infants younger than 6 months are particularly prone to nasal congestion, which can lead to upper respiratory infections. So always try to make sure that nasal passages are clear and unobstructed by mucus. The infant's rib cage is less rigid than an adult, and the ribs sit horizontally. Infants can be belly breathers. You'll see their belly go up and down really fast, and because of excessive muscles or immature fatigue can set in very quickly. An infant does have a proportionally larger tongue and shorter, narrow, less stable airway, so it can be obstructed more easily than in children and adults. So I always think about with your baby M's, remember that the infant's lungs are fragile, so don't try to use forceful ventilation. It could cause trauma from pressure and bariatric trauma. The nervous system continues to evolve after birth. A neonate is born with certain reflexes. Startle reflex happens when a neonate is surprised by something or someone. He or she will open up her arms really wide, spread her fingers, and seems to grab at things. A palmar grasp occurs when an object is placed in the neonate's palm. The rooting reflex takes place when something touches the neonate's cheek. The neonate will turn his or her head towards the touch, and the second reflex occurs when the infant's lips are stroked. So, fontanelles are the area of space between the bones that eventually fuse to form the skull. 3 or 4 bones of the skull eventually bind together to form suture joints. So you got the posterior fontanelle, normally fuses by 3 months of age, The anterior fontanelle usually between 9 to 18 months age. If either of these are depressed, most likely the infant is dehydrated. So, um, inner bulging fontanelle is indicative of intracranial pressure. So, with the musculoskeletal system, growth plates are located on either end of the long bones and aiding in lengthening, okay, basically the child getting taller. Bones grow in thickness by building on themselves. The renal system, infants can become dehydrated easily because the kidneys cannot produce concentrated urine. So an infant's urine consists mainly of water, which can cause the development of electrolyte imbalances. So I always think about that when you have a infant that has been vomiting or something like that frequently. The immune system for the first 6 months of life, the immune system maintains some of the mother's immunity, so the infant naturally acquires some passive immunity. The infant can also receive antibodies by the breastfeeding. Psychosocial um, begins at birth and evolves as the infant interacts with and reacts to the environment. So rapid changes do occur in the first year of life. Crying is the main method of communicating distress for most infants, so bonding is based on secure attachment. Um, Anxious avoidant attachment is found in infants who are repeatedly rejected. So secure attachment occurs when the infant understands that parents or caregivers will be responsive to his or her needs. Um, Separation anxiety is common in older infants. So the infant may be clingy behavior and fear an unfamiliar place or people. So trust and mistrust refers to the stage of development from birth to about 18 months. And most infants desire a planned, organized routine, and they gain your trust in caregivers or develop a sense of mistrust. So basically, what they're saying, if you got an infant that will just go to a stranger, um, that's usually a sign that there's more going on in that situation that may need to be looked into. So most infants will come to you and gain trust with you, um, and then become more um, calm. All right, from age 1 to 3 years old, you consider a toddler. Pulse rate 80 to 140 beats per minute. Respiratory rate 22 to 37. Systolic would be 86 to 106. Body temperatures would be 96.8 to 99.6 degrees Fahrenheit. And it's usually leveling off by 98.6 by school year age. So the lungs continue to develop um, to have more bronchioles and alveoli. So passive immunity is lost from what they gained in um, from their mothers. So neuromuscular explorers spend a great deal of time finding out exactly how to use the nervous system and muscles. By the end of this stage, preschoolers will have a brain that weighs about 90% of its final adult weight. Playing games places stress on the muscle and bone, so that increases the muscle mass and bone density. Continued development of the renal system and elimination process. So, um, physiologically, toddlers have neuromuscular control and capable of bladder control by 12, 15 months of age. So they'll be potty trained pretty much. Teething occurs. It can be painful, accompanied by fever. So you may want to ask that question. A lot of times, new parents especially, they'll call for fevers and stuff. And it's basically they are teething. So, and the leading cause of death by this age group is unintentional injuries. All right, so psychosocial changes. They learn to speak and express themselves. Toddlers are very attached to their parents, feel safe with them. Separation anxiety peaks between 10 and 18 months. At 36 months, a basic language is mastered. So they continue to refine these skills throughout childhood. By ages 3 to 4, most children can use and understand full sentences. They go from using language to communicate what they want to using creativity and playful interaction and playing games with other children begin. Um, Teaching control, following rules, competitive. By age 18 to 24 months, toddlers begin to understand cause and effect. So if you, I call it with every choice becomes a solution. Um, Children learn to recognize sexual differences by observing their role models. All right, school-age children from ages 6 to 12 are school-age child's vital signs both gradually approach their adulthood vital signs. Pulse rates, usually between 58 to 118. Respiratory rates 18 to 25. Cystoscopy 97 to 120. Um, these children usually grow about 4 pounds and 2.5 inches each year. So that's a lot of growth in these years. Their brain activity increases to both hemispheres. Permanent teeth begin to replace the child's primary teeth. So unintentional injuries are still a leading cause of death. Some psychosocial changes, critical time in development where children learn various types of reasoning. So pre-conventional reasoning children act almost purely to avoid punishment and get what they want. So they can be they try to stay out of trouble, but they know what they want and they're going to try to get it by pushing your buttons. Excuse me. Conventional reasoning children look for approval from their peers in society. Post-conventional reasoning children make decisions guided by their conscience. So they begin to develop their self-concept and self-esteem. So self-concept is our perception of ourselves. Self-esteem is how we feel about ourselves and how we fit in with our peers. All right, adolescence. Vital signs, vital signs begin to level off within the more adult ranges. Pulse rate between 50 to 100. Respiratory rate 12 to 20. Systolic blood pressure 110 to 130. So they do experience a rapid 2 to 3 growth spurt, increase in muscle and bone growth and body changes. Growth begins with the hands and feet, and then the long bones of the extremities, and then the growth of the torso itself. Girls generally finish growing by the age of 16 years, and boys continue to 18. So, reproductive system, um, reproductive systems, and secondary sexual development takes place. Unintentional injuries are still the leading cause of death for adolescents. Some psychosocial changes. Adolescents try to gain control of their lives and independence from their parents. So privacy does become an issue. Self-consciousness increases. Adolescents may struggle to create their own identity. They use feedback from their families and peers to help create their adult image. They often want to be treated like adults. Yet care for like younger children. Rebellion can occur, and they're just trying to find his or her identity. Peer pressure is a major factor. Antisocial behavior peaks in 8th and 9th grade. Eating disorders may develop because of their increased obsession with body image. Self-destructive behaviors such as smoking, drinking, sex, and other high-risk behaviors may begin. greater interest in sexual relations, code of personal ethics develops based partly on parents' ethics and values and partly on the influence of adult adolescence environment. So they um, get it from both ways, both from peers and adults, so at higher risk than other populations for suicide and depression. All right, the adult years pulse rate remains around 70. Their story rate 12 to 20. It's systolic blood pressure anywhere between 90 to 140. From ages 19 to 25, the body should be functioning at its optimal level. Lifelong habits and routines develop, wear and tear on bones, um, and changes in body tissue and muscles begin. Disc in the spine begin to settle in height, sometimes strength. The tissue increases, which leads to weight gain. Muscle strength decreases and reflexes slow, and some unintentional injuries, the leading cause of death in age in this age group. So life centers around work and family stress. Job stress becomes high. Marriages and childbirth are common. As far as people starting to settle down. So one or more stable periods of life generally fuel fewer psychological problems related to the well-being of themselves. All right. Middle adults, age 41 to 60. So average pulse rate remains around 70, 12 to 20 respirations, 90 to 40 systolic. The body still functions at a high level. However, they are vulnerable to vision and hearing loss and other degrees of degradation. Cardiovascular health becomes an issue in many people. Cancer incidence increases. May begin having medical symptoms or be unaware of conditions such as diabetes and hypertension. Menopause takes place in the late 40s and early 50s. Exercise and a healthy diet can help diminish many of the effects of aging. Um, so, unintentional injuries are still the leading cause of death. So, but however, from ages 45 to 60, the leading cause of death is cancer. Some psychosocial changes focus is on achieving life goals. Middle adults usually readjust their lifestyle, has children leave home. Finances become worrisome issues. Having physical, emotional, and spiritual reserves to handle life issues. They may find themselves caring for children leaving for college and care for their aging parents as well. So it does create a little bit more stress. So unintentional injuries are, the leading cause of death up to about age 44, and then cancer, and then heart disease and cancer. All right, older adults, 61 and older. This life expectancy is constantly changing. Approximately 78-year-old to a max of 120. So a lot of it's based on their year of birth and country in which the person lives. Vital signs, heart disease and cancer are leading causes of death. Vital signs depend on their overall health, medical conditions, medications taken, often overcome numerous medical problems, and they may need numerous. The cardiovascular function declines in age, largely due to atherosclerosis. Heart rate and cardiac output decreases. Vascular system becomes stiff. So the diastolic pressure increases with their age. Heart must work harder, and blood flow to the organs is reduced. Ability to produce replacement blood cells declines as does the blood volume. So bone marrow is replaced with fatty tissue, which leads to other problems. The respiratory system, size of airway increases, and smooth muscle weakness and surface area alveoli decreases. Some natural Elasticity of the lung also decreases, so they use the intercostal muscles more. The chest may become rigid due to the calcification of the ribs and the sternum. The overall strength of the diaphragm decreases. The breathing becomes more labor intensive. Changes are often gradual and go unnoticed until a severe life-threatening condition does occur. And gradual loss of mechanisms that protect the upper airway. Their decreased ability to clear secretions. Um, the number of cilia that line the airways diminishes, so that does result in less sensation and responsiveness when the structures of the upper airway are inverted. So aspirations and obstruction become more likely. So smooth muscles of the lower airway weaken with age. So strong inhalation can make the walls of the airway collapse inward and cause an inspiratory wheezing. Because of that, overall decrease in the metabolic activity of older adults leads to increased risk of lung infection. By age 75, the vital capacity may amount to only 50% of the vital capacity noted in young adulthood. So they have loss of restored muscle mass, increased stiffness of the thoracic cage, decreased surface area available for the exchange area. All right, endocrine system. People tend to slow down their physical activity, but tend not to decrease their fluid intake, so the insulin production drops off, and metabolism decreases with age, so they are more prone to diabetes. So, changes in mental status may be the result of blood glucose levels. Their reproductive system, men are able to produce sperm long into the age, but rigidity tends to decrease over time. So women have a decreased size in the uterus. Hormone production for both sexes decrease, and their sexual desire may diminish, but it does not cease. Renal and gastral systems, filtration function declines by 50% from age 20 to 90. Kidney mass decreases 20% over the same span. Decreased ability to clear waste. Changes in gastric and intestinal function may inhibit nutritional intake and utilization, results in vitamin and mineral deficiencies. Taste bud sensitivity decreases, teeth become weaker, saliva secretion decreases, gastric acid decreases, blood flow to mesenteric vessel drops, decreasing the ability of the intestines to extract nutrients from digested food, and so gallstones become more common. Nervous system, the brain weight may decrease 10 to 20% by age 80. So motor sensory neurons networks become slower, less responsive. Metabolic rate in older brain does not change, and oxygen consumption remains constant. So the diminished number of brain cells comes with the interconnection between the brain cells continue as people age, providing redundancy within the brain. So this causes a loss of neurons, but not a loss of knowledge or skill, and the sleep patterns may change. That's why you find a lot of older adults who'll be sleeping during the day and awake all night. Age-related shrinkage. Age-related shrinkage creates a void between the brain and outermost layer of the meninges, which provides room for the brain to move when stressed. The peripheral nerve sensation is diminished and misinterpreted, so you have slower reaction times. Slow down reflexes and decreased kinesthetic sense may contribute to the incidence of falls and trauma. So, they walk, they bump into something, but they can't maintain themselves up, and that's how they fall. So, nerve endings deteriorate and the ability of the skin to sense that these surroundings becomes hindered. So someone may not even realize that they're hurt, but they really are. Secondary changes most older adults can see and hear well. Some may need eyeglasses or hearing aids. Do not assume that older adults are deaf and blind. So pupillary reaction and ocular movements become more restricted with age. Pupils are smaller. Um, Visual distortions are common, so you may see some bifocals being used. Hearing loss is 4 times more common than vision loss. So some psychosocial changes, older adults share a great amount of wisdom with us, and we need to remind them of their self-worth. Um, so until about 5 years before death, most late-stage adults retain high brain function. Um, There is an increased number of adults in the U.S. as a result of the baby boom from the 1940s to the 1960s. So it has produced a need for more assisted living facilities. Financial limitations may restrict access to health care and medication. And that's looking at Medicare and the limited retirement funds they may have. Psychosocial changes continue. In 5 years preceding death, mental function is presumed to decline. So a lot of older adults may feel useless and worry about being a burden to their family. Um, so one of the most important things is they're needing to face is mortality. So sometimes they isolate themselves, and a lot of depression comes into play. So this is chapter 9. 20 and 28. This stock will be 89 to 112, and the weight gain should start to level off some.